Does it feel like medicine has failed you? It's all pills and procedures? Have you seen the overreach in healthcare policy and politics? I want to empower you with the knowledge that you need to make your own best decisions. Welcome to the Underdog RN podcast. Knowledge is power, so empower yourself. Welcome back to the Underdog RN podcast. So today I want to do things just a little bit differently. I've had something weighing on my mind, and it's just driving me absolutely crazy with health insurance and healthcare pricing and the billing and all of it. So for any of you that don't know, my son, our youngest son, was born with a club foot. I'll show you some pictures here. This is what clubfoot looks like. This is the boots and bar that he's currently in. And what that does is it helps prevent his foot from reverting back to a clubfoot. So these shoes basically control my son's ability to walk. Like without these, his foot could revert totally back. He'd have to go through their serial casting that he had to do and have changed every single week. And then he had to have a surgery, a tenotomy. They go in, they clip the tendon, and we have to get these as he grows. We have to go up in sizes. So we went for our follow-up appointment, and our pediatric orthopedic surgeon is amazing. He is fantastic. We drive to St. Louis just to see this man because when he went into the boots and bar there, we could have transferred his care down here to a more local provider, but we just want to stick with the same physician. His bedside is phenomenal. He gave me a lot of peace of mind back in the beginning. What concerns me here is we went to this appointment. He'd had a huge growth spurt just the week prior. And so he had shot through a whole size, basically. And these shoes, they come in chronological order. So it's 0, 1, 2, 3, 4, etc. He'll have to wear these till he's 4. Well, the rep comes in. He fits him, just like always, which basically means he's got these multiple, just the flat part of the boot, and brings it in, puts it on his foot and says, okay, yep, he's went from a size 2 to 3, or in this case, it was a 1 to a 3. And then he brings me in 3, 4 pieces of paper. I got to fill it out, insurance information, sign here. Yes, yada, yada. We can have his health information from the doctor's office because it's 2 totally separate companies. He's from the DME company, so durable medical equipment. I do all this, and typically it takes a week to 2 to get the boots in the mail. They come to my house. Well, we get 2, 3 weeks out, and we don't have them. So he's getting these little hot spots, kind of like what you see here. And I'm getting concerned because I'm a nurse. I know all about pressure sores and wounds. And I looked at all the most horrific things you could online when I found out he had a clubfoot and all the things we were going to have to do for it. And so I want to get these boots like as soon as possible. So I call the doctor's office. They send me these voicemails. I leave messages. I don't hear anything. And finally I get this letter on a Friday evening that's dated for the week prior that tells me I owe like $130, I think it was, for these boots, and that my order will not be processed until payment's received, and that if I don't reply within 30 days of the invoice, they're going to delete my account and the order has to be all redone and everything. So over the weekend, I'm not happy, obviously, and they're not open. So I call first thing Monday morning. I get on the phone with the lady's number who was on there, and I explained to her, I've been trying to reach you guys. I don't understand. I got no phone calls, no voicemails, no text messages, and I get text messages for his appointments and everything else. And I understand that's through the doctor and you're the DME, but there's contact information for us, both me and my husband. Neither one of us got anything. Well, yeah, we left you a voicemail. She says my cell phone number, and I said, no, I don't have any voicemails from you, from anyone. And I've been trying to reach you. So I tell her, I'm like, well, I want this order expedited. Like, I'll pay whatever the fee is for overnight shipping. I want them sent overnight. And she says, well, that's up to the manufacturer. I told her, okay, that's fine. Who's the manufacturer? I want their contact information. And she's getting frustrated with me and short with me. Why? I don't know. I'm not happy. I'm being very direct, but I'm not being rude. I'm a stressed mother This is my son's ability to walk. So I want this information. I want to do everything in my power to make sure that he gets what he needs as soon as possible, like any parent would do. So she says, well, all I have is a web address for them, and you can try to reach them, but they won't even have your order until we take your payment. And I say, okay, that's fine. I'll make the payment, and then I want their web address. So she takes my payment information and it processes and all that, and she says, well, it's mdorthopedics.com. I love that place, by the way. And I say, okay, thanks. So I call the manufacturer. I go to the manufacturer's website. Then I get their contact information. Super easy, like right there. Call the manufacturer. This wonderful woman answers. And she tells me that whoever places the order has to put it as overnight shipping. And I was like, that's great. The DME company told me it was you. So that's fine. I'll call them back and speak to her again. And I said, well, while I'm here, like, I don't want to wait for these, and I explained to her what happened. Is there any way I can directly order from you guys? She goes, oh yeah, of course, just straight from our website. Now, I hadn't really taken a look around the website. I just looked for contact and boom. So I say, okay, well, how much do these run? She tells me $250 for these boots. And I say, oh, okay, I can see that. Though I'm sure for the actual manufacturing cost is significantly less, but that's besides the point. $250, that's really not that terrible. And I say, okay, that's great. And she goes, yeah, and we'll send you an invoice and everything so that you can submit to your insurance for reimbursement with our tax ID and yada, 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 all the things. And I'm like, well, that's even better, because why not? Like, try to get some money back from my insurance for paying for it all out of pocket myself, right? So then I call the DME place back and I say, I want to request overnight shipping. I called the manufacturer. They told me that it is whoever orders it. And the woman tells me, well, I'll have to get with the guy who orders those. Really? Okay. All right. Cool. Great. Thank you. What's the cost for these? Like, if I'm paying the $130 here, what's the cost for these? She goes, they run about $1,600. And that right there, I was like, okay. Because I've heard of these kind of things. I've seen it with other patients and other people when I worked in clinic and even when I worked in the hospitals. So I say, okay, so 1,600 and some change something. And I say, okay, well, how do we get from $250 through the manufacturer to 1,600 from you guys? And she pauses. And I said, well, I can order straight from their website for $250, have it shipped straight to my house, and no muss, no fuss. And she'll send me the stuff so I can get whatever reimbursed through my insurance. She says, well, this covers your fittings and your orthotist visits, and, starts rambling a whole bunch of stuff. And I'm like, I don't use any of that. The only thing that I get from you guys is there's a rep at the physician's office, my surgeon's office, and he comes in, puts the neck size up on his foot and says, yep, this is the correct size, and then brings me paperwork. That's it. That's the only interaction I have with you guys. I don't use any of these other services at all whatsoever. So why is it $1,600 and something? And how am I only responsible for $130 of it? I'm just curious how all this works. And she says, well, your insurance pays $1,000. And I said, okay. So if my insurance pays $1,000, there's $1,600. Where's the other $400 something? And she basically tells me that it's like written off through the company or whatever. I don't even understand what she's saying, because she starts rambling a whole bunch of different like codes through the insurance company, and the codes for that and the codes for this, and we have to put it here. And I'm like, this is very simple math. So I say, well, I want them expedited. You call me back. She goes, yes. So she talks to the guy. She calls me back just a little while later, tells me that it's a $50. The manufacturer should have told me it's an additional $50 fee. And I said, that's fine. I told you I'll pay for whatever. I want them overnighted. She goes, okay. So I pay the additional $50. And she's like, they should be there tomorrow. And I said, okay. So they are going to be at my house tomorrow. This is overnight shipping. She goes, yes. Tomorrow comes and goes, no shoes. So I call back on Wednesday and I'm like, well, I want that refunded. If I didn't get them, it's the next day now and I didn't get them. So I want that refunded. That's something that you guys can pay and I want to know where they are. Do I need to call the manufacturer? Do I need to call you? I called the manufacturer anyway and left a message there. And do I need to call, like, who's handling this? How do I handle this from there? And she goes, well, let me get you my supervisor about the refund. And so I talked to the supervisor and she seemed a little more intelligible about kind of how the billing worked, but she still started rambling on about all these different coding processes and, you know, they have to cover the cost of everything and some insurances pay more and some pay less. And I stopped her right there and I said, wait, you're telling me that if my insurance pays more, because my insurance will pay more, if somebody else's insurance only pays you, you know, $700, my insurance is supposed to cover the cost, the split difference there. Well, you know, some pay less, some pay more, so we have to have just a general cost. And I said, yes, but that doesn't explain to me how I can go on this website, order these exact items that I need for $250, and you all mark them up to $1,600. That's like a 500 something % markup. That's ridiculous. And all you do is process some paperwork and put in some codes in a computer. And you've already charged my insurance $1,000, which is 4 times higher than what they're charging. Like, my insurance has paid you $1,000. I've paid you $130. They're only $250, and I'm sure the manufacturer's not selling at cost. Okay, that would just be naive thinking. And I said, so where's the other 400 something? And she said, well, that's through, you know, we look at this and we look at that. And I mean, it was a jumbled up, ridiculous mess. And I got a bill. I didn't get a bill. I got like a invoice, receipt, whatever, from the DME company who broke this down into like 3 or 4 different charges, showing me the $1,600 something. I'm going to try to find that and post it for you guys. And I'm like, this is absolutely ridiculous. How in the world is something this simple marked up this high? That's crazy. That is absolutely insane. And so now consider I pay $350, $400 in insurance per paycheck because my entire family is covered on my medical. Per paycheck. I'm paying more than my car payment in medical insurance. So I have started inquiring as to what the cost is for my son's actual care, like what he needs, because all he needs from this point is his follow-up visits and those boots as he grows, which are crazy simple to fit. And I called the doctor's office, or I talked to them the last time I was in there, and confirmed that as an established patient, his office visit is $75. So for $75 plus the $250 in boots, that is one medical insurance payment for us. It's less, actually. It's a little bit less. I've paid, so far in this year, I've paid over $2,000 for medical insurance. That's all we've used it for. Because we go, for our primary care, we go to a direct primary care. So that's where you pay a membership fee, basically, and it gets us unlimited office visits. So my kids get an earache, I call that office. We get in the same day to see NP, PA, whoever is there, and go in and see them. I know them. They're wonderful. We have a great relationship with all of them. My kids love them. It's a very friendly, clean place. There's no chaos. There's none of it. It's not like a sterile medical environment. They've got little toys. It's fantastic. So I pay for that. So this is the only reason that we really sought out medical insurance. Now, I understand you need medical insurance. I had my gallbladder out unexpectedly last year after having our son. I totally get surgeries, catastrophic events, all of that kind of stuff. My point is the transparency in medical billing and pricing practices and what your options you are given. Like, I've never been told that I could go and just order the boots myself. It's a super simple process. You literally just put his foot in the boot and you just keep ordering the next size up. So in the next month or so, I'm going to order the next size up myself, submit it to my insurance, and then when his foot grows to the appropriate place, we'll switch him. It's so simple. And I don't understand why it has to be like it is here. Like, there's here, around here where I'm at, there's a local independent place where you can go get MRIs, CTs, and ultrasounds done. I don't understand why that place can show cash pricing. Like, period, this is, $250. For somebody who has no insurance, this is how much it costs. And then you call some of the major hospital networks and they say, oh yeah, it's $1,200 something, $1,500 something. Why? That makes zero sense at all. You have more people using those bigger hospital networks for their imaging, but the price is higher. Insurance is dictating so much in healthcare, it's ridiculous. Anybody who's dealt with health insurance for anything knows that, like, the pre-auth kind of stuff, like getting something pre-authorized for imaging, surgery, whatever, is just, it's such a sham. It is the most ridiculous thing in the world. When I was doing those, you would call and there's a person who would answer the phone and they would quite literally be reading a prompt. You could tell they're just, yes. So have they had any abdominal pain? Yes, they have. Has their pain been located in the right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant? The right lower quadrant. Okay. Have they had this pain for greater than 24 hours, greater than 1 week? How long has this been going on? And I'm like, and you have to go through this. Like, I had a patient one time denied for a abdominal CT because there was no differential diagnosis. So the lady is having abdominal pain. We have done an ultrasound. Didn't show anything. This has been going on and on and on. And she's coming in. She needs a CT scan. This is in a clinic, so it's not like at a hospital, urgent, emergency situation. And the insurance wants to turn it down because we don't know why she's having abdominal pain. That's the point of the scan. The only thing I found here that kind of made sense or that helped get around some of that was doing the doc to doc, which takes so much time to get to that process, right? They deny the claim. They're like, okay, you'll be notified by fax or whatever within 24 to 72 hours, something like that. And so they fax you this whole paper and it's telling you, well, they were denied, It's got all the tiny print stuff, to cover them. And then it's like, if you want to appeal this, you can do a doc to doc, which basically means that the practitioner, so NPPA, doc, whoever it is ordering the scan, can call and speak to the insurance's provider, practitioner, whoever. And so I only had to do this a couple of times because when I was handling this, it was about what the patient needed. It was about what is best for them. And we always prioritize them. And so if that meant making a phone call, being on hold for however long, going through however many million prompts, whatever, I did it. And every time I did it, the doctor's like, oh yeah, of course, approved. Like that, just approved. What? So you have all of these computer systems in place. You have all these people you're paying to read these prompts, check these boxes for approval or denial of whether this person needs this scan, needs this drug, needs this treatment, whatever it is. And an actual practitioner gets on the phone and within 2 minutes, not even, like get through the situation. They're like, oh yeah, approved. Are you kidding me? Are you kidding me? That's not even the worst of it. When you look at the billing practices, my husband went for a procedure at one point. It was an in-office outpatient procedure. And he goes for the procedure, and he didn't have insurance at this time. We had just insured me and the kids. And they tell him, well, are you doing cash or are you doing insurance? And he goes, oh, I'm paying cash. How much is it? $1,200. $1,200. Boom, done. I think there was like an office visit of like 100 or something. Okay, nothing. And flat rate. And the lady's like, oh, great. That means we can get you scheduled sooner. And he goes, what do you mean? She goes, oh, if you were using insurance, we'd have to wait at least 2 weeks to schedule you. And when I was doing scheduling for procedures and specialty consults and whatever else in the clinic, it was the same thing. Like these hospital systems, they have to have 2 weeks. They want to wait 2 weeks to schedule you so that they can work through the insurance process. Dead serious. If you call like central scheduling is what a lot of places call it, and you give them the patient's information and they have their chart and they pull it all up and you're like, okay, this is what they need I don't know, colonoscopy. Okay. All right. Well, we need to get this approved through insurance, or they need a heart monitor. Okay. Well, we got to get this approved through insurance. So we'll schedule them out here. That's 3 weeks from now. Why are we doing that? They're having palpitations and, we want to get this started as soon as possible. Why you got to wait 3 weeks? Well, we got to process through the insurance. Unless you got the pre-auth. Did you get the pre-auth? And that's why I would do the pre-auths. And the other nurse I worked with, she dreaded it. she absolutely dreaded it because it's such a daunting, long process. It's ridiculous. And a lot of places, frankly, just don't take the time. Like when you go to your doctor's office and they tell you, well, you need to have this place or that place or whatever, ask the nurse, are you going to do the pre-auth? Like, do you guys do the pre-auth for that here? And then when they tell you, oh, no, we sent it to central scheduling, blah, blah, blah. That's why it's 3 weeks before you get your CT scan even scheduled. Or they schedule you out that far. It is abysmal what we are doing. And we want to know why healthcare is backed up. And we want to know why you get a bill, you get 15,000 letters, 15 million bills, and this is not a bill. This is a bill. This is, you owe this. And everything's billed separately too in a lot of places. Like the doctor has a fee, and then the imaging place has a fee, and the radiologist who read the imaging has a fee, and then the facility itself has its own fee. And it's the most outrageous system ever. When you go to a mechanic, okay, your car, all right, here's how much the diagnostic is to figure out what's wrong. We're just going to plug it in and do this. This is how much this costs. Okay, cool. Do that. Tell me what it is. This is what it is. Okay. It could be this. It could be this. It could be this. Okay, great. What do those cost? This. Okay. Well, we need to do this or that to look into these couple of things and determine really what it is. That's going to cost blah, blah, blah. Like you're paying for labor and time. Healthcare does not have to be billed this complex. This is ridiculous. And I don't think for 1 second that what I'm dealing with my son's boots and his clubfoot stuff is anything in comparison to some of these other things. I mean, when you go and have anything done, do they tell you the price? Well, you have an office visit of this, but you might get a bill again later. What? No. And it was funny because we also got a bill not too long ago, just a little bit ago, for our office visit, and we owe $15. And on the bill, it says that the office visit was $150. So why is the office visit $150 when I was told the cash price is $75? Why is it double when you bill it through my insurance? And then I still pay you $15. So my insurance is paying everything else. I'm paying $15. Why do I owe you anything? It's $75. None of this makes any sense. So I want to encourage all of you, anyone seeking healthcare, period, start asking questions. Well, how much is that? And don't ask, well, how much is that going to be after my insurance? Because they can't tell you. They can't tell you. They got to go through, like, put the paperwork through under certain codes. And we're going to get into this whole coding system and the American Medical Association and them writing this coding system and then Medicare using this coding system and setting a price. And then that's what the insurance is all billed theirs off of. It's a whole convoluted system. And it links all the way to Medicare, the hospital systems, insurance companies, the federal government setting all this stuff. Like, does your employer offer you car insurance? Home insurance? Now, if you work for an insurance agency, probably, or some kind of insurance company. But why in the world can we not shop for health insurance like we do those? Why when you go work somewhere, okay, here's who we do insurance with. Here are the couple of options that they offer us. And I'm paying almost $400, but my employer is also paying for the insurance. So for $2,000 and something that I've paid in this year, my insurance has saved me, let's see, I think he's had 2 visits. That's $150 at cash price. And this is his second set of boots. So $500, $650. So not even a full month of what I'm paying for insurance is what, and I haven't even saved all of that because I paid the $130 and I'm going to pay the $15. So what in the world is going on? Like, why are we paying these ridiculously high premiums for family medical, then paying bills on top of that and co-pays? I don't get it. Because I understand the healthcare systems. You know, I've been in the ER, I've been in the hospital. I see the people that are not going to pay their bills, that the people that don't have insurance and things are nothing gets paid. Like, I get all that, but I'm not paying for that. And if I'm paying my insurance company and my employer's paying my insurance company, but the hospitals or whoever, like who is marking all this stuff up like crazy? That didn't make any sense to me. The saddest thing, and when the very first time I ever experienced this was working inpatient, actually. I had a patient, he was a young man, had a whole bunch of health conditions. He had one chronic condition that spiraled into a whole bunch of other health conditions, and he was in the hospital. He was trying to file for disability, which would get him, Medicaid, Medicare, and all this stuff, and he needed his prescriptions. It was time for discharge. And I call the pharmacy and I find out, hey, how much are his prescriptions going to be? And they tell me $200 something. And this man doesn't have that. I know he doesn't have that. He's already told me that this is a worry, how he's going to get his medicine and everything else, since he doesn't have any insurance right now and he's waiting on approval and yada, yada. And so we did there's this fund that patients could use one time per lifetime, and it would cover their medications. And so I tell him it's the 200 something. I say, look, we're going to look into trying to utilize this fund for you and get it paid for. And so when you do that, you have to call the pharmacy and say, hey, we're using this fund. How much are they, on there? Because you have to fill this whole paperwork out for the patient and put that amount on there and then submit that form. $7. It was $7 for the fund. Are you kidding me? $7? So I'll tell you, I'm really impressed with what I think it's Mark Cuban is doing. It's Cost Plus Drugs. If you don't know about that, Cost Plus Drugs, Google it, look it up. He does transparent pricing for medications. Now, you can't get everything. I don't think you can get insulin. You can't get narcotics and all that kind of stuff because they mail it to your house. But he has paired up with a pharmacist and shows you this is the cost of the drug. They mark it up 15% to handle personnel and, profit and whatever. Like, it's a business. They're going to make money off of it like anything else. So this is the cost. This is the 15% markup. This is what we charge you. Now, there's been a few times that things like when I call the pharmacies for patients on their insurance and stuff, that they do get it a couple dollars cheaper. And so it's really not worth waiting. But that right there, that's an amazing system coming around. And they add more and more medications. So if you don't know about that, Cost Plus Drugs is a great resource to go looking if your medications are crazy expensive or you don't have insurance. GoodRx is great. I really want to dig into that more and how that works. But I just had to talk to you guys about this because it just blows my mind that it's this bad. And these are the steps. Like in each of these episodes, I want to talk about what you can do and what we all need to do to start fixing this. We've got to start fixing this system. And frankly, they've got to be held accountable. Insurance companies, Medicare, Medicaid, all of it, healthcare systems, whatever. Like we've got to get transparent billing processes. That's a necessity. Where else do you go and not receive an itemized receipt that you can read most of the time? I know when I go to my mechanic or dealership or anything, like here's the oil, this is the price of the oil filter, the tire rotation, all of it. Okay. So first start asking questions. That's the biggest thing. Start asking questions just out of curiosity, right? When you go to the doctor's office, be like, so if I didn't have health insurance, what would be the cash price for a visit? As the pharmacist, what's the cash price of this medicine? Like how much is the medicine? And see what they tell you. Just to start gathering knowledge, right? So you can start seeing, kind of looking at how everything's happening. Secondly, we've got to do legislation. Like I'm going to be reaching out and writing up an email with all this information, proof of all of it, and sending it out to my state and federal level legislators. Like this is ridiculous. People are being ripped off. Period. You're being ripped off. Okay. There is no reason whatsoever that something should be marked up over 500%. And then I was not even given the option to know that I could purchase these. And then a lot of people don't know you can submit to your insurance for reimbursement on stuff. So we're going to start talking about all of this and covering all this. And I'm going to keep you guys posted on how this stuff goes. Like I'll publish the email. I don't care. I'll publish it out. And then if you want to copy it, I'm going to put it up on Telegram, Twitter. I'll put it up on my website, which I am still working on. That's the next thing. Like we've got to have legislation that there has to be transparent billing processes. And then you have to start educating yourself also on all of the available resources you have through healthcare, right? Like I didn't even know as a nurse I could go and purchase straight from the manufacturer. So that's something I've learned recently that I am going to be looking at from here on out, and I will be sharing all of those tips and tricks with you guys. I would also be intrigued to call your insurance. I'm going to call my insurance and talk to them about all this and ask them like what their thoughts are, how they like handle all of this. Because I was also told in that conversation that the insurance has contracts with the manufacturer, and well, if they have a contract with the manufacturer, then why in the world are they paying $1,000 for a $250 pair of boots? Okay, that doesn't make sense to me either. Are they doing that so they can tell me, well, look, this is what they were. This is how much we paid for you, so keep paying us. What? Okay. I hope that's not it. But if that's it, we need to do something about that. And then just get involved yourself. So take some of the information I tell you, share this. I'm going to put all this up. This is why I'm doing it in a kind of a different way, because I want you to see all these different things. I want you to know that what I'm telling you is legitimate, and I don't mind sharing my own personal stuff and letting you know how it's working out for me. So I hope that this was informative. I know I get worked up about it. It's my son. It's his health. It's his ability to walk. This means a lot to me. And I am so sick of how we are doing things. Like this cannot keep up. So I hope you'll share this. I hope that you like it, subscribe to it, put it all out. Feel free when I'll get the email typed up, and when I post it, make sure that you're hitting the little notification bells on whatever platform you're following me on so that you can see it and write something similar to your legislators, or feel free to share what I write and then all the stuff in it, because I'm going to put everything in there. Like, this is not okay, and I am experiencing it, and this is all fact and all true, and so you can't deny it. So I want to know why this is happening, and we need to have laws that protect the people from all of this insanity. So I hope you learned something, and I can't wait to talk to you guys next time. Have a great day. Thank you for tuning in today. I hope that you found some of the information insightful and helps you advocate for your own care or someone else's. I want to encourage you to follow me on Twitter, Rumble, YouTube, Telegram. You can also find me at my website, underdogrn.com. Knowledge is power, so empower yourself, and let's make it make sense.